We're here this evening with Pete Ferguson, who was commissioner in Stark County for 4 years, decided not to run again. And as commissioner, Mr. Ferguson's primary concern, I think, was consolidation, merger, cooperation, collaboration, whatever you call it, in terms of local government services. And recently there's been some news about a study that was commissioned by a local charitable organization to look at the feasibility of merging health departments across Stark County. And former Commissioner Ferguson has some thoughts on that.
Well, I think the report is great news. One of the things, as you know, when we traveled around the county a year and a half ago trying to promote the sales tax, at many of the township meetings, it was brought up about the merging of the health departments. I think most of the township people were very concerned and upset about it because they didn't want to pay any more money for their services. I think this report shows that it's not going to cost more money. So that's a great positive thing. I want to thank the Sisters of Charity for giving the money to do this study. I think I've been trying to do this for 15, 18, 20 years, trying to look at merging these departments. I think there's so much duplication of services, and I think without affecting nurses and people that work in these departments, I think that we could manage it. I think that we could give people more jobs or other jobs to do besides the ones they're doing. But I think it's a great step forward, and it's a positive step. They did it in Summit County with great success. Barberton just came on board with the rest of Summit County. They know they can save money, they know they can make their services more effective. And really that's what I wanted to do in the county when I became commissioner and when I sat in the Canton Health Board. I wanted to make it more desirable, more effective, saving the taxpayers' money and making the service good. Well,
you notice that Dr. Ferguson referred to working on this project 18 to 20 years. Dr. Ferguson's a well-known chiropractor in Stark County, and so your interest predates having become a commissioner.
Right, it has. And you know, I remember Tom Harmon, Bob Horowitz. There was a number of people that really looked at this issue 15, 18, 20 years ago. But they just couldn't get over that first step. And I think with the Sisters of Charity giving the county and the city money to do this study and bringing a group in to really look at this for the first time and say, hey, this is feasible. It's advisable. It's not going to cost people more money. It's not going to have people lose their jobs. We can do it by attrition. There's some positive things to this, and I really look forward. I told Jim Adams last night, the Canton Health Commissioner, I said, you know, we really want to move forward on this. I asked him to, if we can get a hold of Tom Burnaby and Janet Creighton and Richard Regular, and have a work session and tell them where we are, the commissioners, where we are on this. I think that they'll be excited, and I think that they'll get behind this like they have been in the past.
So you see that as the next step?
I really do. I think that we want to have a work session with the commissioners to let them know where we are and how we're going to continue on this. I think Tom and Janet know my passion for this, and they wanted me to continue being part of this, and I would gladly do so. I think the next step is getting a committee to really look into the nuts and bolts of this and how we can affect this.
Now, would that be another committee or the one that did the study?
No, I think that the one that did the study would probably still be advising us on it. He may add a little more people involved, a couple more people involved, but I think basically it'll be the same people.
Okay. And is that committee open to meeting with the commissioners? Do you know?
You know, again, Jim said to me last night, you think it would be a good idea? I said, I think it'd be a great idea to have a work session with the commission, and I think all work sessions are open to the public. So.